Thank you for joining us. I'm Toke Eid, the director of the Keynes Fund in Cambridge, and my guest today is Sriya Iyer. We're here to talk about your new Keynes Fund project, Religion and COVID-19. What is your research question?
So our research question is interested in how religion might affect the spread of diseases, and in turn, how mental health, especially the incidence of depression, is affected by religion. In times of crisis, such as natural disasters, people tend to look to religion more for solace or comfort that is being provided by faith communities. Hence, in the event of a pandemic such as COVID-19, attendance at places of worship might well increase, since on average, people might visit places of religious worship more. And this phenomenon is generalizable across most of the world's religions, whether they are congregational or not. At the same time, the COVID-19 pandemic has created a situation where the lack of access to religion because of lockdowns or social distancing measures might in turn affect mental health. In our project, we're investigating both of these dimensions.
What are you looking at that hasn't been addressed before?
The main question that we're looking at, which hasn't been addressed before, is how do big shocks like a pandemic essentially affect religious networks? We know that religious networks might become denser because people who are already religious might spend more time in religious gatherings and with co-religionists. And this might increase the chances of their getting an infection from a co-religionist. Meanwhile, people might also substitute other activities such as sports or other recreational activities, which might then decrease the risk of a disease being brought into a community and spread from the religious community to people outside. So what we're aiming to do is to test the hypothesis by collecting data right across the globe to look at areas with both large and small congregations and how this might in fact correlate with the incidence of COVID-19. At the same time, the interaction of religion and COVID-19 induced restrictions on mental health might also be important to investigate. We know that if you have lockdowns and social distancing measures, this is going to have an effect on religiosity and mental health. And we know that many of these public health measures have restricted religious gatherings of all kinds. So this might affect the followers of religions that mandate regular communal gatherings at places of worship. This has consequences for the way in which people practice their religion, not least because not being physically present at a place of worship can't be easily substituted with electronic means of team communication. We're interested in looking at the difference between small frequent gatherings versus large infrequent ones. And in order to test this hypothesis, we're conducting online surveys that elicit responses on how COVID-19 restrictions have essentially affected, first, the way people practice their religion, second, whether religious congregations have actually moved online, and has this differentially affected the followers of different faiths, and finally, how disruptions in practicing one's faith might have affected mental health.
How is your research innovative?
So I think our work is one of the early surveys which is going to be looking at the psychological effect of religion on mental health in a pandemic situation, essentially as it is taking place. We've completed already a number of pilot surveys on respondents from certain states in the United States. And the pilot survey collected data on about 300 individuals. While this sample size is relatively small, we've already found a high incidence of depression. More than 70% of the respondents in pilot surveys can be classified as depressed. 20% of the sample reported themselves or a member of their immediate family as having tested positive for COVID-19. And a quarter of the sample have reported themselves as having attended a religious event with 50 people or more in the month before lockdown. We've also found that there are a range of different methods of accessing religious activities during lockdown, including the provision of online services. And I think that getting at some of these interactions with a much bigger sample of 5,000 respondents across all of the United States, which is essentially what the Keynes Fund grant will allow us to do, is something that we're hoping to say much more about in terms of the effect of religion on well-being and how this might well correlate with the incidence of disease such as COVID-19.
What wider social issues does your research address?
So economists are interested in a particular subfield of economics that we call the economics of religion. And the reason that they're interested in this is because over 80% of people in the world report a religious affiliation. So if we are looking at this project in the context of the economics of religion, we will have something to say about the role of religion in economy and society more widely. Economists also are very interested in the economics of disease, whether that is physical health or indeed mental health. So our project, by putting these two together, the economics of religion and the economics of disease, might well help us address wider social issues about the mingling of heterogeneous communities, both religious and otherwise, but also perhaps to say something about the factors that might underlie the tendency for religious conflict and other kinds of conflict across the world.
How can your research help us understand more about the economy and society?
Economists are interested more generally in the behavior of market participants. And we're interested in the behavior of market participants in times of an unprecedented economic and health crisis, such as COVID-19. This itself is an interesting topic because, as we know, importantly, it has affected both lives and livelihoods right across the world. Our project is looking at how market participants might, in effect, perpetuate and propagate a contagion, and in turn, how a contagion itself might affect mental health. My sense is that if we understand the behavior of these market participants in propagating a contagion and how a contagion affects mental health, this might provide valuable first steps in designing effective and efficient public policies to combat similar epidemics in the future in order to promote sustained economic growth and general well-being. Of course, all of this has come just after Christmas, which all of us have just been through. And I think that has also brought into focus issues around congregating with families and loved ones at an individual basis, as well as the mental health consequences of not being able to do so. I think our indicative numbers demonstrate that the questions about religious activities, the spread of COVID-19 and mental health may well turn out to be substantive and important, not just for economics research, but also for social science more broadly.
One of the objectives of the Keynes Fund is to strengthen the research base in Cambridge and help younger researchers establish themselves. How does your project do that?
I think the Keynes Fund is extraordinarily important, both in strengthening our research base in applied economics here in Cambridge, but also helping younger researchers to progress their careers. In this project, the two other principal investigators on this project are Dr. Girish Behel, who's now an assistant professor at the University of Western Australia, and Dr. Anand Srivastava, who's an assistant professor at Azim Premji University in Bangalore. Both of them are early career researchers who did their PhDs in macroeconomics and empirical microeconomics in our faculty and are essentially taking the economics that we taught them here at Cambridge to other parts of the world. This project, because it is a collaborative exercise, is going to help them consolidate their own research. And we're also going to be hiring an RA on this project who we expect will be a current graduate student in the faculty. And that's going to provide very valuable experience of what academic research involves for this person as well. I think the Keynes Fund today is really supporting now in practice what Keynes and indeed his predecessor, Alfred Marshall, before him, had always envisioned for Cambridge economics: to send people out into the world with cool heads but warm hearts, to discover how far it is possible to open up to all the material means of a refined and noble life.